takes place. Okay? If pregnancy does not take place, then what happened? Okay? And regressing. And finally there will be a dot, and this is known as corpus luteum albicans. Corpus luteum albicans. Alb means whitish, a whitish dot, and it will remain inside the ovary lifelong. Okay, so this is when there is no pregnancy, but when there is a pregnancy it will remain, and it will remain is bigger with hypervascular prominent. Sometimes you will see this blood turn into clot, and you will see internal echo inside. Then click the color. You need to examine this corpus luteum is active or non-active. Pregnancy is there, corpus luteum is in the ovary, and you click the color, you see there is no color around the corpus luteum. What does it mean? You will see the corpus luteum is dead, inactive. So what going to happen? That will be miscarriage. Okay, so this is the 3 phases of the ovarian cycle, and this is the released ovum, and this released ovum is well protected because the ovum is surrounded by a group of cells. Okay, and there is a 2 layers. Okay, corona radiata and zona pellucida. Okay, an ovum, when it is, this ovum is like this. These are the cells, and this is corona radiata. And let me put the color here. Zona pellucida. It's a pale. Okay, under microscope you can see it is a pale, and then you will see there is a nucleus over here. And this is the cytoplasm, and the polar body is here, primary or first polar. So this is nucleus, and this is the polar body. Okay, so this is ovum, this is ovum, the released ovum. Okay, so this ovum we're going to discuss it more and more during the obstetric lecture. But as of now, for the ovarian cycle, we understood the three phases: pre-ovulatory phase, ovulatory phase, post-ovulatory phase. Consider as a 28 days a complete cycle, ovarian cycle and the menstrual cycle. And the pre-ovulatory is from day 1 to 14th day. Okay? And it plus minus 2. And primary follicle is converted into Graafian follicle during this time with the influence of pituitary, follicle stimulating hormone that comes from pituitary gland. And during this time, the cells around the follicle, they produce estrogen, and the cortex of the ovary produce estrogen. Okay, the estrogen level is going up, up, up in a linear fashion. During the ovulatory phase, which is on the day of 14 plus minus 2, the estrogen will touch its peak level. That time, the pituitary gland will release the luteinizing hormone. So, luteinizing hormone is surged by the pituitary gland with the estrogen peak. And if the estrogen does not touch the peak, the luteinizing hormone LH will not be released and the ovulation will not take place. Okay, so we got, look at here, this is one hormone, this is another hormone, this is another hormone, okay, and the post-ovulatory phase is from 15th to 28 plus minus 2, and after ovulation the corpus luteum is formed and the luteum produce another hormone. So there are 4 hormones so far we got now. If pregnancy takes place, corpus luteum will persist 10 to 12 weeks. That is the first trimester. If pregnancy does not take place, the corpus luteum will turn into corpus luteum albicans and vanish. Okay? So now I will discuss about the menstrual cycle. The 3 phases I'm going to discuss. Then I will give you the big chart for you. Now, menstrual cycle. Menstrual cycle, we usually call it the uterine cycle. And this menstrual cycle has 28 plus minus 2. Those the duration. Okay? So menstrual cycle is solely concerned with the uterus. Okay? So we call it uterine cycle. And has 3 phases. And these three phases are menstruation, or we call it period, and proliferative phase, and secretory phase. Menstrual phase is day 1 to 5 days, okay, up to 5 days average. It can be less, it can be more. Proliferative phase, day 6 to 14th. Secretory phase, 15 to 28. Okay? So on 28th, it should stop the secretory phase and the menstrual phase should appear. Okay? And this menstrual phase is due to the withdrawal of the progesterone. Okay? It is due to the withdrawal of progesterone. Due to withdrawal of progesterone. Why? Because the corpus luteum dies. Because there is no pregnancy. So, the next period starts. Proliferative phase, this is with the influence. Let me write down here first. Influenced by estrogen, and that comes from the ovary. The secretory phase, starts from 15 days to 28 plus minus 2, and this secretory phase influenced by progesterone mainly. A little estrogen, but mostly progesterone. And during the secretory phase, there is a more proliferation of the gland ducts and blood vessels, proliferation of branches of the ducts and blood vessels, and making is very juicy endometrium. And that is influenced by the progesterone, because the corpus luteum is producing progesterone until the next period starts. So until then, secretory phase of the uterus is still believe that yes, maybe I'll be pregnant. I should take my guest as a fertilized egg. Okay? And if progesterone is decreased suddenly and secretory phase is over, and the next period will start. Okay? So these are the 3 phases. It is a uterine cycle, has 3 phases, and 28 plus minus 2 days long. Okay? 2 days long. This menstrual cycle can be 35 days. Some people may have 2 cycles in 1 month, but that has definitely causes. But some people may have period every 35 days and continue. Keep that in mind. If it is a 35 days, means the 5 weeks. Whatever that weeks, the secretory phase will be only 2 weeks. It is fixed. The proliferative phase may be changed, may be prolonged, but the secretory phase will be fixed, that is 2 weeks. After ovulation, 2 weeks is secretory phase. Proliferative phase may be 3 weeks, so total 5 weeks. Okay, so now I will draw the diagram, but before going, then we have to understand what is menarche and what is menopause. The menarche is the first onset of the period. Usually it happens 12 years or 13 years. Some girl may have early menarche, early onset of period, precocious puberty, and that is no good. Some girl may have period at the age of 9, 10, and that is no good. They need to be checked out. Okay? And during their fertility life, up to 45 years or 48 years, after that they developed menopause. There is symptoms of menopause, we call it premenopausal symptoms. Usually it happens 1 to 2 years before the real menopause. Okay? And there are a lot of unusual symptoms because the estrogen level is going down and the woman does not feel good. A lot of hot flash, anxiety, different feelings in the body. They don't like anything. Okay? So we have to understand during that time they need more support. Okay? So now I will draw the diagram. One more thing. the early menopause and the late menopause. Neither is good. Neither is good. Okay? We need to evaluate. We need to evaluate the pelvic organs, hormonal assay. We need to check. Okay? So now let me draw the uterus, showing you that during the period what is shaded out. Okay? Okay, so this is mother cells. Okay, this is mother cell. His name is tunica basalis. Tunica basalis. And there is another layer called tunica functionalis. Okay, so now this is tunica functionalis. Okay, and this is endometrial cavity. Endocavity or uterine cavity. Okay, so during the period, this tunica functionalis are shaded out, but tunica basalis is not. It is firmly attached with the junction of the myometrium. It does not get lost during the period. When the period starts, so then you will see this. Okay, now let me cover off the whole endometrial cavity with the endometrium. Okay, so during the period, what happened? The endometrium tunica functionalis starts